Hi guys, I'm Stephy Steph, and this is Bobby.
Hello everybody.
And we are Between Two Teeth. We have a special guest on today, President-elect candidate, Dr. Stephy Doroshow.
Hey, how's everybody doing?
Thank you. Thank you for joining us.
And I have to just say, a lot of people do know me as
Let's see, are we working there?
A lot of people do know me as Sue, but I'm trying to use my grown-up name for the campaign. So
absolutely.
You can call me Susan, or you can call me T-Rex, which is my nickname, because I have a big appetite for leadership, and I don't want the ADA to become extinct.
Oh, I love that.
Yeah.
So we're going to jump right into it, Sue. What does the future of the ADA look like to you?
You know what? It'll really depend on what the House of Delegates does this meeting, I think, because right now we're sort of in crisis. We're in crisis stage. And membership is not going to change. We're not going to be able to turn the membership train around. People are not joining membership the way they used to back in the day. We've been struggling for over 20 years, doing the same thing over and over again, and we need a new business model if we're going to sustain the association. So I think right now we're at a pivotal point. If we make a change, pivot away from our current dues dependency to something else, we have a chance of saving the association. And if we don't, I think we're going to end up like Sears Roebuck.
What was that, Sears what?
Yeah, exactly. Who knows? Even
What's a Sears what? Does anybody else in the audience know what that is?
Okay. Back in the day.
Oh, we got one person out there.
Back in the day, there was a famous retailer that had a catalog that was about 800 pages thick that was sent to you in the mail. And you would go to the store, or you would call a number and order stuff, and it would come to your door like Amazon, but it would take like 2 weeks.
Wow, okay. So, well, Bobby, any follow-up on that?
So part of what you're talking about is pivoting away from dues membership.
We're talking about change.
Dues dependency.
Dues dependency.
ADA can do 5 things for the profession that are critical. That's advocacy, testing, accreditation, science, and standards. There's no other entity, certainly not in the US, certainly not globally, who does those things for the profession of dentistry. And we need to continue to do those, and we need to have the resources to do them. If we fall into decline and die, and we have probably reserves and real estate that would allow us to be sustained for probably 25 to 30 years, even if things tank, lower, spiral worse. But those 5 things keep dentistry a profession. If we can't do them, if we don't do them, dentistry becomes a trade.
And Susan, can you repeat those 5 things again?
Absolutely. Testing, accreditation, science, standards, and standard science, advocacy, testing, accreditation. I got to do those again. Testing,
Go for it.
accreditation, science, standards. What did it?
That's
got
5.
it.
That's it. That's 5.
That's 5 things.
I had a finger amputated at an early age, and
Well, and as you talked
man.
about, I mentioned yesterday during opening session, my son is pre-dental. I want this to be the best profession. I want this to be the best association. I think that's what we all want, and change can certainly be part of that.
Yeah, certainly. And one of the things when we have a market share of dentists that's only 50%, 40%, 30%, if you believe, like I do, that the ADA membership gives you access to resources that make you a better dentist, that make you deliver better patient care, and only 30% of us have access to those things, we're shortchanging all the patients that are being treated by that other 70%. We can't have that. If we truly believe in dentistry as a profession, we cannot allow some patients to not get the benefits of what the ADA resources offer. That's especially science, but certainly the code of ethics, certainly standards. Now, dentists get standards anyway, but it's interesting because dental students or even dental educators will say the ADA doesn't do anything.
Right.
I don't know. I go to the office every day. My handpiece fits the coupler. The burrs fit the handpiece. That's because of 700 plus volunteers at the ADA who work on standards.
Yeah.
If your software communicates with your x-rays, that's standards.
I love how you brought up the ADA team on this. I mean, we love the ADA team. They're part of the reason all of this is happening, and we have all of our members enjoying weeks like today. And we get to do what we do because of the ADA
And it's
team.
Volunteers, it's staff, it's everybody. I want to pivot if I can.
Sure.
Specifically, sort of what best qualities do you bring to the table? You're running for president-elect of the ADA.
Correct.
We are so excited that you're here in this forum so non-delegates can kind of hear you talk, but what do you bring to the table?
I think I bring a unique array of experience. And the key thing in this race, and this is not to criticize the other candidates. I don't want anyone to read into that, because our paradigm right now is candidates run as senior trustees from the Board of Trustees. And anyone who's served on a board understands that candidacy and service may not always be in sync. There's a conflict there. I finished my term as trustee last year. I'm campaigning now. My service as a trustee was not impacted by my campaign. An urge to campaign, an urge to do anything except serve the association as best I could as a trustee. And now I have the freedom, because I don't have to embrace what the board is doing. I have knowledge of it because as a candidate, I've been allowed to be a guest at the board meetings. I have been excluded from closed sessions. I've been excluded from the reports of the executive director. I haven't been present for strategic discussions, but I remain informed. And I have 25 years of experience, and my focus and my passion have always been membership. Okay. So I bring that. The things we're doing now in membership are the same things we did when I was chair of membership in 2008, 2009.
And I love what you talk about. When you talk experience and membership, I think we need to lean on the experience of our leadership, but also be open to new ideas like you're talking about. And I think there's a harmony there, and there's a balance and a nuance in taking the experience with some change and some new ideas. And I think that's where the ball can really start rolling, and we can start moving in a new direction.
We ignore what goes on in the rest of the world at our own peril. I mean, truly, and we are.
I ignore a lot of things.
Bobby,
it hurts
Bobby,
me.
Bobby.
It hurts me at times. I know. I'm gonna try.
Really, don't throw yourself on your sword here in the middle of the podcast.
Man.
But truly, I mean, other organizations are struggling. Look at Boy Scouts; their membership's probably dropped off, 60% in the last decade. They talk about selling off camp properties. Who doesn't know a church or a synagogue in their neighborhood that had to close or merge with another one? The idea of membership as we knew it in the 50s and 60s is not a contemporary one. People are not joiners in that way anymore. And yet we have Amazon Prime members. Is that really membership? Yeah. No. But it proves people are willing to pay a subscription type fee to get services.
Yeah.
And that's another possible business model.
Okay.
It's definitely a lot of things to talk about, especially when we talk about these different business models. I just kind of thinking about it, Bobby, you did your MBA recently, and one of the things that I did in my surgical leadership program was we kind of bounce ideas off of each other about how to make these changes and not just have the change, but be effective. Yeah. And being right and being effective are two different things. And so I hope we can start to see, some of these positive ideas that I hear from so many people start to have some effectiveness and change and gain some footholds and some ground here.
It's going to take a radical transformation, because our focus has been always market share, or numbers. And we've been offering free and discounted dues, for instance, to new graduates in an effort to drag them into membership. I don't know if anybody who's listening actually uses a Groupon model to build their dental practice, but that's what we've been trying to do with membership. And we've created a whole generation of former members that are way harder to recruit than never members. So some of this we've shot ourselves in the foot in an effort to prop up our numbers.
As you've been on the campaign trail, what are some of the big things you've heard from members? Are they talking about change like that, or
I think there's two sides of this. Some people understand, and younger dentists in particular understand the challenges that we're facing. They don't have the same marriage to traditional practice models. They don't have the same ideas about what it means to serve the public. And I'm not saying they're worse, but I think younger dentists are more receptive to the idea that there's potential patients who aren't getting care, that there's parts of the population that aren't being treated, and they're receptive to discussions about how we get treatment to them.
The younger generation are in tune with a lot of things that others are not. And Steph talked about this yesterday as far as mentoring up, mentoring down. Mm-hmm. We need to all be having discussions.
I consider myself still part of the younger generation of dentists, and
so do I. I consider myself part of the.
I feel like I could speak on this a little bit, but we're bright-eyed, bushy-tailed. We want to get in there, we want an organization that's going to be truly our organization that drives us into the future. So Susan, thank you so much.
On that note, thank you so
for
much.
being
Thank
on
you.
here.
Thank
We
you for the
really
chance to talk,
appreciated it.
and thanks for the chance to have an audience here at SmileCon.
Thank you.
Appreciate it.
Thank you so much. Thank you. Well done.
Thank you, Sue.